So for those of you who don't know me, my name is Christine Lee. I'm a rheumatologist. I practice in Beverly Hills, and I have a special interest in lupus patients. And so today what we're going to focus on is actually one of the lupus medications, Safnello. So we're going to focus on that with some basic information about what lupus is and how this drug might play a role in treating patients with lupus. So I'm going to go ahead and get started now. And if you have any questions, feel free to type them in. If we don't have time, then we'll talk about, well, I'll answer them later on and we can type them up for you. So today we're going to learn about Safnello, also known as anifrolumab. So this presentation was developed by AstraZeneca to help providers consider Safnello as an add-on therapy under the guidance of healthcare providers such as myself. This presentation doesn't provide medical advice or recommendations, and patients should follow up with their providers with questions specific to their treatment plan. So Safnello is a prescription medicine used to treat adults with moderate to severe systemic lupus erythematosus, or lupus, who are receiving background standard lupus medicines. It's not known if Safnello is effective in patients with severe active lupus nephritis or those with severe active CNS lupus. It's also not known if Safnello is safe and effective in patients under 18 years of age. So, background information on lupus. So lupus is a chronic autoimmune disease in which the body's immune system attacks its own tissues and organs. So this is a multi-organ, or what we call a systemic chronic autoimmune disease. So there's a whole spectrum of autoimmune diseases, including some you might be familiar with in other worlds or systems, such as psoriasis or inflammatory bowel disease or Crohn's. So lupus is unique in that it can affect really any organ in your body. So your brains and nerves, your lungs, your digestive system, your musculoskeletal system, your hematology blood system, skin, kidneys, your heart, your eyes even. So it's something that we look at very carefully. We want to prevent organ damage and quickly. And lupus can affect everyone very differently. So some of you may have rashes and fatigue, and that's who you are. Other people have joint pain. They may have a lot of brain fog. Their blood counts might be low. Platelets might be low. They might have heart inflammation, lung inflammations, and everyone is different. So it's very hard to know necessarily or compare yourself to someone else who has lupus because they may have a totally different type of lupus than you. So what is a lupus flare? So flares occur when your lupus symptoms get worse and you can start to feel sick. These can happen on and off and can be unpredictable. Sometimes they happen without symptoms and are only seen via lab tests. So that's why it's really important, if you have lupus, to follow up with your doctors regularly. I do like to see my lupus patients generally every 3 months, unless you're doing really well, then maybe every 6 months. But even if you're feeling fine, you do need to get your labs checked, as mentioned here, because flares can happen. So that's why it's so important, especially for something as screening for protein in your urine, screening for lupus nephritis. That's something you wouldn't really necessarily be able to tell unless you came in and you had your blood and urine checked. So organ damage can continue over time, even if your lupus disease activity or symptoms are reduced. So when I first see a patient or I diagnose them with lupus, I make sure they do understand that this is going to be a chronic disease, and we want to control it right away. We want to treat you, because if we leave you untreated, or even if you feel like you might be okay, I just don't want to risk future organ damage. So there are, thankfully now, more medicines to treat lupus. Many of these medicines we use in other autoimmune diseases as well. So these can include NSAIDs, non-steroidal anti-inflammatory drugs, such as ibuprofen, naproxen, meloxicam, anti-malarials, predominantly hydroxychloroquine, immunosuppressives, and these can mean disease-modifying anti-rheumatic drugs like methotrexate, azathioprine, mycophenolate, leflunomide, and steroids, which most of the time we use something called prednisone, as I'm sure you're all aware of. And there are now also targeted therapies for lupus, and these are monoclonal antibodies, otherwise known as biologics. So let's talk about steroid use in lupus. So oral steroids are often used to control lupus disease activity and flares. They work great, and many of you probably feel awesome when you're on it. However, we can't keep people on steroids for too long at too high of a dose, because that's when it can start leading to organ damage or risk of other health problems in the future. So you see some of these listed here: cataracts, glaucoma, diabetes, organ damage. It can thin your skin out, and it can thin your organ lining. So sometimes being on steroids long-term can increase your risk for gastrointestinal tract perforations, for example. So not to scare you, because steroids really are very effective, and when used properly are totally appropriate, but we just don't want to use them long term. And another condition that many of our patients have too is osteoporosis or weak bones. And since everyone's lupus experience is unique, it's important to talk to your doctor about your lupus and your particular treatment plan, and just go over the risks and benefits of all medications. So now we're going to focus specifically on Saphnelo, which, as I mentioned before, is a prescription medicine used to treat adults only right now with moderate to severe systemic lupus erythematosus who are receiving other lupus medicines. It's not approved at this time for severe active lupus nephritis or central nervous system lupus. So how does Saphnelo work? It is a biologic agent. It is the first and only FDA-approved treatment for adults with moderate to severe lupus that works by blocking interferon 1 activity. So type 1 interferon, we know, plays a key role in lupus. About 85% of lupus patients do carry an interferon signature. This is not something we normally are able to readily check for at this time in clinics. So this isn't something that, as part of our diagnosis, we're able to check lupus patients and see what their interferon 1 levels are at this time, or if there's ability, it's usually quite expensive and cumbersome to do. So assuming just statistically if 85% of lupus patients have a higher interferon 1 signature, then it makes sense to look at this as a target for treating lupus. So interferon 1, you can think about as it's basically a cytokine that can cause pro-inflammatory cytokines. So many of the medicines out there now are trying to decrease the pro-inflammatory cytokines. You can think of them as tiny messengers in your body that send signals to several types of immune cells to activate the immune system when needed. So when there's high levels of interferon 1, that can actually cause your immune cells to attack your own body. The clinical studies for Saphnelo are evaluated here. So there was a 1-year study that looked at a group of patients who were put on Saphnelo plus their usual background lupus medicines, and then one group of patients who received placebo plus their usual lupus medicines. And placebo is basically a mock drug. It will look and be administered like the real drug, so patients don't know if they're, and the provider who's administering in the trial don't know which patients are on the Saphnelo versus the placebo. So what was studied was the primary endpoint, which is looking at a change in lupus disease activity. And there are various measures that are used in clinical trials for looking at lupus disease activity. And that's usually a combination of clinical findings, like if they have arthritis, if they have rash, if they have pleurisy, which is inflammation of the lungs, and also lab findings. So what sort of antibodies they have, their complement levels, inflammation levels, things like that. So secondary endpoints in this trial looked at joint flares, skin flares, number of general flares, as well as the oral steroid use. So at the start of the clinical study, patients were on one or more of the following lupus medicines, and then this was the background therapy, and then Safnello or placebo were added. So many patients were on antimalarials, oral steroids, immunosuppressants, or non-steroidal anti-inflammatory drugs. So that was the initial clinical study. There's actually been 3 clinical studies so far with greater than 1,000 total participants. Participants ranged in age from 18 to 69 years of age, and a diverse group of patients participated in studies. And what I mean by diverse is not just age, but also ethnicity and race and gender, which is very important when you're looking at drugs, especially in a country as diverse as the United States, where you don't just have one ethnicity, you have many different groups. And so making sure that this medicine is appropriate for all sorts of people is super important. So Safnello can help reduce disease activity. What it showed was when it was given together with other medicines for lupus, it could reduce disease activity as compared to other lupus medicines alone. Now, everyone is different, but this is why we have clinical trials and data so you can make your own informed decisions about what might be appropriate for you. And it shouldn't be just you, the patient, it should be you, the provider, not you, but your provider. And what they saw were improvement in levels of fatigue, rashes, muscle and joint pains, as well as improvement in other organ systems and lab findings. There were consistent results that were observed across a diverse group of people. So why might Safnello be right for you? It's been shown that adding Safnello to your current regimen can reduce your disease activity across all organ systems. It can reduce lupus flares. It can reduce oral steroids, which is very important because, as I mentioned before, all the potential long-term side effects of being on chronic steroids. And it works quickly. So that's also super important. That's something my patients always ask is, when might I feel improvement? And with the data that we have here, I am able to tell patients, as early as even 1 infusion, 4 weeks, you may feel some changes already. And I think that's really important because sometimes medicines really can take up to 6 months to reach peak efficacy. And not to say you're going to reach peak efficacy in a month, but you will see some improvement. And I think that's really encouraging for patients. So well-being as reported by patients, more patients taking Safnello reported feeling better compared to other lupus medicines alone. So how did they feel better? They felt better physically, they felt better emotionally, they had less pain, less fatigue, they had a better idea of their body image, and part of that may be related to being able to come down on steroids faster. As we know, steroids can cause a lot of puffiness and weight gain. They felt less of a burden to others. They felt like they had more initiative in planning their life and improvement in intimate relationships. So let's talk about if you were to start Safnello. So Safnello comes in an infusion only. It is 1 dose every 4 weeks, and it's given through an IV. So you would need to be referred to an infusion center if your provider does not have one on site. The infusion is pretty quick. It's about 30 minutes. Like I said, it's given every 4 weeks. And if you miss an appointment, that's okay. Just try to get it whenever you're able to. If you are sick in any way or you're on antibiotics, then we usually like to delay the infusion. And that's okay too, because this is an immunosuppressant too. And so if you're sick and you're getting this infusion, it just may make it harder for you to get over your infection. Let's talk a little bit about safety information. So the most common side effects of Safnello, it being an immunosuppressant, is upper respiratory infections. So colds, bronchitis, sinusitis, that sort of thing. There was a 34% risk of upper respiratory infections or rate of infections compared to a 23% with patients on other lupus medicines alone without the addition of Safnello. Infusion reactions were seen in about almost 10% compared to 7% who were on the placebo group. And herpes zoster is what causes shingles, and that was a 6% rate compared to a 1.3% rate. So I personally like to have patients vaccinated with the Shingrix vaccine, the shingles vaccine. It's a two-part series. It is a killed vaccine, so it is okay to get. It's not live. So I like to just have one dose of the shingles vaccine before people start Safnello, and then they can get the second dose later on. But if you've ever had shingles, you know it's terrible, and I just don't want anyone to get it. So that's why, as a safety precaution, I personally like to have my patients vaccinated before they start. So other safety information, of course, you wouldn't use Safnello if you were allergic to the anifrolumab, which is the name for Safnello. Before you start Safnello, tell your doctor about any of your medical conditions. What I mentioned before, if you think you have an infection or a recurring infection, if you think you're going to get a vaccine. Now, you can get your flu shot, you can get your COVID booster while you're on these medicines. They just have to be timed correctly in between your doses. If you have a history of cancer, let your doctor know. We always weigh the risk benefits. If you're on other biologics, we would not use this in combination with that. If you're pregnant or planning to become pregnant, Safnello, really all clinical trials do not involve pregnant women. So no one ever knows if drugs cause any sort of harm with pregnancy or breastfeeding. So there is a registry you can enroll patients in, or you yourself, if you become pregnant, can enroll. You can call AstraZeneca at the number here to find out more information there. It's also not known if Safnello is passed through your breast milk. So that's something to weigh the risk benefits of too. Again, let your provider know what sort of prescription and over-the-counter medicines, vitamins, herbal supplements you're taking, just to make sure there's no interactions there. Because it's an immunosuppressant, it can cause infections. So you would be at a higher risk of developing respiratory infections and shingles, which, as we looked at in the data before, there was a higher rate of both of these types of infections in the patients who were on Safnello. If you have a severe anaphylactic allergic reaction to Safnello, the good thing is that you would be receiving this in a controlled setting in an infusion center with nurses, doctors, other providers around. So they would be there to monitor you carefully should you develop any swelling of your face, mouth, and tongue, breathing problems, fainting, dizziness, or lightheadedness. This is very rare, but this is why it's important to get this medicine in a medical setting. Now, Safnello can reduce the activity of your immune system, and medicines that affect your immune system can also increase your risk of certain cancers. So while that was not directly seen in the clinical trials, that is something we would be cautious about if you have an active cancer. Now, I mentioned the most common side effects of Safnello here. We talked about infusion reactions, and there's also more data online or AstraZeneca can provide. And I'm happy to answer any concerns that you have at a later time too. So where to get help if Safnello might be a medicine you're interested in or your provider thinks is appropriate for you. So AstraZeneca Access 360 is a support program that helps you answer your questions about insurance coverage and out-of-pocket costs. AstraZeneca really is on your side as far as trying to give you access to the medicine. If you have commercial insurance, you may be able to get Safnello for as little as $0. There's a nurse helpline if you have questions about Safnello. There's also care coaching and a welcome kit that gives you some resources and information on how to get approved for the drug and what you should expect with starting the drug. And this concludes my presentation on Safnello with some background information on lupus. And let me know if you have any questions.
Nice. Thank you so much, Dr. Lee. That was really great. I was just going to ask if patients have any questions, they should talk to their doctor to learn more.
Yeah. Hmm.
Awesome. If just for anybody who's listening, if you have any other questions about the presentation today or about Dr. Lee and her practice, just reach out to us at info@lupusla.org or send us a direct message and we can help get you to what you need. I think we do have a couple questions. I think there is one question on if side effects would happen in a patient, how early would that be? Is that something, is that just depends on the patient?
Yeah. So this being an infusion, typically the most common would be if you're going to have anything, it's usually the day of infusion. Um, Usually nothing is as terrible as like a huge infusion reaction, but what pa most patients commonly experience is they might feel a little tired the next day from having had an IV. Um, but the symptoms don't last for more than a day or two after patients get an infusion. So, and what I find is the more doses you get of the medication, as far as your body gets used to it, usually the side effects dwindle.
Okay. Thank you so much. That's
No
incredibly
problem.
helpful. Um, again, anyone, if you have questions, just reach out to us. But thank you so much for your time today, Dr. Lee. We really appreciate it.
Yeah, no, I'm happy to help, and I hope everyone has a wonderful Friday.
Great.